Hi everyone, AnneMarie Czyz here with another episode of AMC Connects. Thanks for tuning back in. Want to just let you know in this episode it is going to be pretty brief. We'll have a fast one. It's already the end of the first month of 2026.
Already.
So
That's
we're going to talk a bit about that. So on this episode, we will do a report from the state. The reference point is going to be the Hospital Association of New York. We have a mask mandate update. I think some good news, at least for the minute. And we'll talk a little bit about what's happened in the first month of the new year. So stay with me. It's just me on this episode, and we'll spend about 15, maybe 20 minutes on a few updates that are, I think, pretty important. First, I want to say that, I took a few days off recently.
Good for you.
Thank you,
Good.
Chuck,
I'm glad.
I missed you. I was hoping to be able to grab a little bit of warmth, a little bit of sun. I think, Chuck, for the people who are viewing the podcast, this episode will flash up a picture, but as you might be able to see, I do have sunglasses on. Because
that's the good thing. Yeah, I thought you were talking about what's happening. I thought you were talking about what's happening outside. But when you leave and you go to a place like that, you're supposed to bring things with you.
Yes.
And I don't know if you did.
I don't believe I did. And maybe from what you can see briefly from the picture, there was still a heavy sweatsuit on, a heavy coat, but there was sunglasses, but still covered from head to toe, and I didn't bring anything back. But there was a little bit more sun. But I missed everyone. I really did. It's wonderful to take a few days off and take some time off. We all need to do that. But I say this often. I'd rather be at Rome Health than many, many places. And if any, I think. But some sun and some warmth would be great. I missed everybody, so it's great to be back. And came back with a lot of items that are certainly items that we've talked about on an episode before. But as I shared on those previous episodes, we will find out more in 2026 on a variety of these different topics. So I will jump right in. As I shared, we do have an update on New York State's budget that was approved, launched by the governor. And the Hospital Association of New York does a great job, I think, summarizing some of the aspects of national health care and then state health care from these particular narratives. So I'll jump right into their references because, again, I think they summarize pretty well. And the topic really is taking the deeper dive into HR 1. Or the impacts of that OBBBA, which we talked about on a couple episodes now over the last several months when we first heard. And I'm bringing it back, one, because there's more information, but two, I said I would, but three, because it was pretty complicated when we first started talking about it on AMC Connects. But here's just a briefing. On Tuesday, Governor Hochul released a $260 billion executive budget proposal for fiscal year 2027. The fiscal year for the state starts in, I believe, April. So we still have a couple months, but reflecting on a modest 0.7% increase over the last year's enacted budget. While the proposed spending plan is largely centered on affordability, public safety, infrastructure also acknowledges the growing need for the state to actually mitigate significant cuts in federal funding, many of which stem directly from what's now known as HR 1, which we had discussed a bit about. In response, the executive budget proposal continues and builds upon prior year healthcare investments and advances policy proposals intended to bolster hospitals and health system facing some of the unprecedented multi-year reductions. Really important wording and point in there, multi-year challenges driven by HR 1. It's not just 2026 or 2027. These particular impacts from the budget does hit us over the course of about 3 years. So it's going to be with us for a while to talk about. And other damaging fiscal policies, according to Haney's. Although additional action in the budget will be necessary to fully stabilize and secure hospitals and nursing homes, the governor's proposal provides an important starting point from which to build. Importantly, and despite lower than anticipated revenue from managed care organization surcharges, the executive budget maintains the commitment enacted in last year's budget to enhance Medicaid rates for hospital outpatient services and nursing homes. Pretty good news. Not great, but pretty good. The budget also includes a new $750 million state investment to provide additional support for hospitals and nursing homes, as well as $1.3 billion in new capital and operating funding to support safety net transformation program. So what we're learning in this particular set of information is that what Rome Health has enjoyed and has been successful with is receiving transformational grants. That was the program in the past several years that has been available for organizations to tap into as we continue to try to transform healthcare based on specific sets of criteria. This is a little bit different. We have submitted a safety net grant proposal because it was available last year, but this is more where the state funding is going to go into to be able to support the continued need for hospitals. In addition, the budget proposal recognizes the first year of New York's 5-year award under the Federal Rural Health Transformation Program, making available $190 million to support this program. Again, we've talked about this on a past AMC Connects, but when we were talking about the offset of the HR 1 proposal approvals and then impact, the federal government had launched the Rural Health Transformation Grant. And then that is supposed to help supplement some of these deficits for rural health care. A little bit complicated, so I hope you all are following me. While Haney's appreciates many of the investments advanced in this year's executive budget, there are several measures that fail to recognize the significance of the challenges facing the state's healthcare system. So, for example, what that means for Rome Health is even though there's a number of initiatives or pathways in place to attempt to tap into, there's still a deficit significantly that, for example, Rome Health would be facing. Once again, the executive budget proposes to reduce supportive programs such as Vital Access Provider Assurance Program by $520 million. Now, for several years, on and off, Rome Health has been in that program and has received funding through that program. And so this notification that there's a sizable reduction does in fact impact Rome Health. Now, we've tried to plan for that in 2026. I think our Chief Medical Officer has done a nice job as he's updated our medical staff, all of you on the medical staff and provider world, by saying we have a good 2026 budget, but it's a stretch and it's challenging because we do not have, at this point, any assumed additional assurances from that particular program. And here it is being validated that a number of those sets of resources will be reduced. The budget also fails to include much needed protection for 340B hospitals, which Rome Health is, and clinics from actions being taken by major drug manufacturers and others. So certainly some good information. I think that was interpreted from, certainly what can be kind of a complicated discussion, which is, when the governor puts out the budget, it's a full budget. Healthcare is just a piece of it. We're just a small part. For us, it's our full part, or for me, spend so much time on that. But I think it's helpful. Thank you, Haney's, as always, for giving some good information and interpretation of that. And so just want to head into some reminders that I think most of us know if we've been with Rome Health for a while. But our strategic plan here at Rome is pretty specific. And hopefully, I'm a little biased, as always. I say that when I say I understand it, but it doesn't mean everybody understands it. But I get to have a key role in developing it. And our strategic plan is really designed around 3 major pillars. Those 3 major pillars that are so important is quality and safety and access to the organization, strong pillar. We have a communication engagement pillar for both us as a workforce, our patients and their caregivers, as well as the community at large. And then third, we have a financial pillar. All 3 of those pillars are really equal. We need those 3 pillars all working in the same direction, and they're kind of interdependent. But we do have special projects within each one of those pillars. So to give you some updates, we are at the close already of the first month of 2026, as I said in the beginning. So we're into February already, everyone. Unbelievable. So how did the first month in 2026 go? I would say there's kind of some mixed reviews. We've certainly made good headway in a variety of different directions, but how it resulted in terms of a month end, I'll just give you some brief thoughts about. So in our quality and safety pillar, certainly making great progress in our open access. Thank you to the emergency department. It was a busy January, lots of visits. We talked a bit about that, real challenges in terms of flu and infectious disease in the community, and we stayed open when others closed. We talked about that, I think, on the last episode. And so there's a brief update there that thank you, everyone, for continuing to have your vigilance around hand hygiene and infection prevention protocols. We have notified everyone that we'll come off the mask mandate. So as promised, when we went on the mask mandate, we were first in the region to do that to try to curb some of us as a workforce and patient spreading. within our workforce and to patients, trying to prevent all that, we were first up, did a great job. So as promised, we'll kind of watch this very closely. We may have to go back on it, but we meet the criteria to come off. So thank you again, and stay in tune to it. When we come to engagement with the community and patient satisfaction, certainly have continued to do a great job. Really impressed with multiple different people and situations that I've heard, maybe when we haven't met everybody's expectations. Every level of the organization really lives the ACT process, acknowledging that we might have somebody who is upset, trying to correct that, and thanking people for bringing it forward. And so I've received a great deal of positive feedback from our patients in the community that we continue to stay engaged with them when they have concerns. So great work there, and keep it up. Our third pillar, a bit more complicated, in that hopefully that introduction helped to provide some clarity. 2026 will be a challenge because we don't have any additional funding. So all of our financial stability will come off of the work that we do each and every day, each one of our services. And so the month of January, we did have a shortfall that we're projecting, and that's largely because our expenses continue to outpace our revenue. We've done a good job with that access, and although January felt very, very, very busy, in terms of our total discharges, they were really kind of where they have been, so that busyness didn't necessarily equal to significant additional volume. We are a little soft on our surgical volume as well, but I'm just going to go over a bit of detail about that, and sending out some messages, so more to come, but if you didn't see those, you can hear them here. But just to summarize again, Rome Health, like hospitals across the country, we are facing some increasing financial pressure from multiple sources. We are committed to being open and consistent in sharing what it means and how we need to move forward together. While our inpatient census was higher, as I said, for the first half of January, we're not meeting key volume targets in other departmental areas, including primary care, endoscopy, surgery, and procedures, behavioral health. As a result, expenses were higher than revenue, as I shared, resulting in an ongoing financial loss that we experienced in January. Looking ahead in 2026, it really is a crucial year. It's a year that we need to actualize on quite a bit of investments that we've had in 24 and 25. It is the year we must prepare for the full impact of the big beautiful bill, or that HR1 that we went over at the beginning, because that will place some additional pressures on us in 2027 and 28, that multi-year impact that we'll see. The actions we take now are really essential for our future. Over the next 2 months, we will take a very focused approach to achieving our volume targets while avoiding new expensive. Now that's the key. Great work, and make sure that our access stays open and we continue to take great care of patients, but we really need to be hyper vigilant on the expenses that we might incur in doing that. Every little bit helps. So at every level of the organization, we really need to keep our eyes on this. This will require adaptability, teamwork, and thoughtful decision-making, again, at every level of the organization. Increasing volume is not just about improving our bottom line or doing more with less. It's really also about ensuring access, again, to the community. When patients receive care at Rome Health, they can stay close to home and rely on services they know and trust. Strong volumes help us keep services available and protect access for people who depend on us. So us working and understanding how we can make sure that we safely and effectively get that volume in. A little bit more to share on that, but we're going to take a quick break for a medical minute, introducing one of our new physicians that has joined Rome Health. So please enjoy.
Hi, my name is Sayali Kulkarni. I'm a board-certified general surgeon, and I specialize in minimally invasive and bariatric surgery. So I'm really excited to be part of the team here and joining Rome, and yeah, I'm just excited to help out. So I usually cover a wide range of services. I can do most general surgery cases, so that includes everything in your abdomen, so including things like gallbladders, appendixes, hernias, colon resections. So that basic general surgery I can take care of. And then I specialize in doing those cases minimally invasively or with the help of a robot. So it's better for the patients, it's slower, less morbidity, there's better healing time, helps you get on your feet faster. And then I have also specialized in bariatric surgery, so weight loss procedures and helping patients kind of explore medical and surgical weight loss options. Well, Rome Health, honestly, definitely because of the location. I have family close by, so this was very important for me to stay here. But after I came to Rome Health, it's definitely everything that I was looking for. It is a small community hospital, but with big dreams. So people are always looking to expand. We have a very big vision here. So I definitely want to help out and contribute to that as much as I can. So if you are interested in learning more about bariatric surgery, or if you have any questions about any general surgical concerns, please feel free to reach out to me, my team. We are here to support you every step of the way.
Wonderful. Chuck, you do so many actions for Rome
So many
Health
people
and
coming in.
so
There's
many
more coming down the
people.
pipeline, so I'm
It's
excited.
Such great news. Dr. Kulkarni, what a wonderful addition to our medical staff. And I'll quote her when I was connecting with her, and she said she's really excited to join the Department of Surgery and really believes that we have an amazing department to continue to take us into the future. So thank you for joining us, and we look forward to getting to know you more, Dr. Kulkarni. And I know our patients in the community will be just so grateful to have a relationship with you if they need it in your specialty focus. So welcome. Back to our report. Another important focus that we need to continue to spend a lot of time on is our extra great patient care when patients are in the hospital, and making sure that they spend only the time they absolutely need to. This can be a tough one because it can feel like we're pushing on our patients, but all patients really do receive a diagnosis to come into the hospital, and that diagnosis is required to meet a particular stay status when patients are in the hospital. And based on that stay and diagnosis, there's a target length of stay that people are kind of allowed or arranged to be able to be taken care of in the hospital, and kind of we work from there. So that important focus in making sure that if we have some of those days that might be increasing for some complex needs. So for example, in January, we did have a number of patients that had some like complicated, safe transitions out of the hospital plan. So maybe they may not have needed a lot of acute care, but to be able to arrange a safe discharge was pretty challenging because they needed a lot of resources. So our days in the hospital kind of went up. As a reminder, if that happens and it's not justified, we don't get paid for those additional days. So that was a big challenge in January as to why some of our expenses went up. So we're going to be continuing to initiate a lot of work and relationships in the community to make sure that we can safely continue to transition our patients when they can, from an acute care lens, of course. Also, over the past few months, Rome Health has followed a real shrink to grow. We haven't said that in a while, but we launched that many, many years ago. Actually, now we really underscored it in 2023 when we were launching the medical center. And the shrink to grow concept really still lives and breathes today. Very transformational, very creative on the Rome Health front. I was really proud of this when the organization came up with this. And really what it means in principle is that we would continue to grow our volume while consolidating, shifting, or working together differently. So when we brought a number of the practices, like in primary care and the subspecialties, onto the main campus's new medical center, it really enabled us to have more care provided to the community, but with our same similar teams in place. And we were able to reduce expenses while growing that particular part of our organization. So we do need to continue to look for more ways to do that. When we're looking at what's upcoming in our opening of PACU and AmSurg and endoscopy, we have teams. I just left a team that's working on being able to open that phase 2 for the surgery center project, bringing post-surgical care together in one location to make it better use of our staffing and our resources, our supplies. We can keep kind of a line on site. Big changes for our frontline caregivers that are trying so hard to redesign that process so we can stay very safe and open. A lot of really remarkable work going on. Keep it up, team, but that's another great example of it. We are excited to receive external support to help us navigate some of these challenges. I mentioned this again, but a little deeper dive in this context. Rome Health was selected as only one of the 8 hospitals nationwide to receive a technical assistance grant through Rural Health stabilization program. This program will provide no-cost consulting to help us address financial pressures, improve operational performance, and better align our services with community needs. We think that we've got a great design, a great strategy, great connecting points, but this is a phenomenal opportunity, again, through this grant, no cost to us, to validate some of the great work that we are doing. The multi-phase program is designed to strengthen our operational and financial foundation in the face of these ongoing challenges that rural hospitals or organizations that take care of rural needs are taking place, including an unfavorable payer mix and the rising costs that I just talked about. We will continue to communicate openly as this work moves forward. You all have asked me for that on a regular basis. How can we talk about things together more before we find out that some major change has happened because we're facing some of these major pressures? And so want to make sure I bring it right to you on an AMC Connects. So thank you for your dedication, flexibility, your involvement, and commitment to our patients and our community. The work you do each and every day is essential to maintaining our access to care, and your engagement will be critical in navigating this next period of time. I know we can do it. It's not going to be by mistake. And we do have to continue to grow and change. I was talking to a number of, kind of frontline caregivers that were saying, oh, AnnMarie, it's just change, that impending change that can kind of make some of us excited, but some of us pretty nervous. One of the ways that we know to get around that is for all of us to stay involved and make sure we stay engaged, informed, and creative on how to be able to go forward. So again, thank you for that. And looking forward to your insight. I hope a deep dive for either those who are just able to listen. I'm really thankful. Many of you have shared some thoughts about the most recent AMC Connects that Chuck and I are doing, and I've got notes. Chuck's gotten notes, and we'll kind of be full steam ahead. We've had a variety of different likes and pieces of information, but somebody just sent me an email recently that said, thank you, AnnMarie. These are really informative. So I hope this one is as well. We do have a mailbag. I'm really excited about this.
Wait, what is it?
Really excited.
What?
Chuck.
Oh my gosh.
It is a mailbag.
I love it. So absolutely. We got one in, and it's actually a social post that we found, but you know what? We'll take it either way. It's a great compliment that one of our wonderful people at Rome Health got a little note for. So here's how it goes. In the healthcare, oh, this is a little loud. Let me turn that down just a little. There we go. All right. In the healthcare field, wonderful experience often comes full circle, and I had a notable experience last week. Dr. Andrade, Chief Medical Officer of Rome Health, visited our medical center, taking the time to speak with medical assistants in every pod, significantly enhancing our morale. His exceptional kindness was evident, but what truly surprised me was when he asked for me by name and offered multiple compliments, thanking me for my dedication and hard work to Dr. Parslow, Rome Health, and our patients. Although I felt somewhat embarrassed by the public acknowledgement, I was deeply appreciative. Appreciative of his positive comments, and for my nurse managers to also telling him the hard work I put forth here. It was truly heartening to hear. That's awesome. That's awesome. Fantastic.
Thank you, Dr. Andrade, for taking the time. And, as that sender said, all of us acknowledging what we do. We got to know each other to know how we like to be rewarded and recognized. But I always say, it doesn't matter if we don't know yet. Don't waste a moment to be able to pass along great news and kudos. So thank you for that, sender, for validating. And you're the first 2026 mailbag sender in. Yes. I will put another plug in, and many people who know me well, and you all are getting to know me really well, like metrics to be able to measure how it is that we're doing. Chuck and I just had a debrief today, and we talked a bit about, where are those likes, where are the views coming from, and certainly the mailbag or other pathways to send in questions, thoughts, or opinions and gratitude are very much going to count in the mailbag. So I'd like to get the metric of the mailbag feedback up and rolling. So please don't hesitate to use that pathway for communications. I would say thank you all for creating the best care out there here. And stay tuned. Thanks for staying with me. And let's keep going in 2026.